Hi, I'm AISWARYA. I'm doing fellowship in Pediatric Optometry under Indian Academy of Optometry. Now I am here in front of you to talk about vision therapy. Vision therapy is the attempt to develop or improve the visual skills and abilities to improve visual comfort, ease and efficiency and change visual perception or interpretation of visual information. Vision therapy is also known as behavioral optometry, vision training, visual therapy, eye training or orthoptic therapy. By doing vision therapy, we can improve depth perception, visual motor coordination, focusing skills, vision, binocular coordination, amblyopia, binocular vision, convergence and stereopsis. The instruments used are lenses, prisms, filters, occlusion, other appropriate materials and equipments. Now we are discussing about the visual training test. The first one is pencil push-up test. For doing pencil push-up test, we have to hold the pencil at one arm distance. And we are asking the patient to bring the pencil straight to the tip of the nose and also ask the patient to report if the pencil strip is blurring or double. When it is blurring or double, the pencil is again taken back to the one arm distance position and again the pencil is brought towards the tip of the nose. Again the blurring point is to be reported. While doing this exercise, the accommodation and convergence are simultaneously working. While looking at the near target, convergence is working and also to make the tip clear, accommodation is also working. So by doing this test, we are stimulating the accommodation and convergence and also relaxing while taking back the pencil. And again, we are stimulating the convergence and accommodation skills so that the accommodation and convergence skills will be improved. We are giving the exercise to the medial rectus muscle to improve the convergence and accommodation skills. The numbers are 46956. Okay. ഇത് നല്ല ക്ലിയർ ആയില്ലേ? ഇനി ഞങ്ങളുടെ എക്സസൈസ് പറഞ്ഞുതരാം. അത് വീട്ടിൽ പോയിട്ട് ചെയ്താൽ മതി കേട്ടോ. എക്സസൈസ് ചെയ്യാൻ വേണ്ടിയിട്ട് ഇതാണോ ആദ്യം ഞാൻ ചെയ്ത് കാണിക്കാം. ഇത് നമ്മളിങ്ങനെ നേരെ ഈ പെന്നിലേക്ക് നോക്കാം. ഇതിങ്ങനെ നോക്കുക. നേരെ കണ്ടോ അപ്പോൾ ഈ പെൻസിൽ ഇതിങ്ങനെ ലെറ്റേഴ്സ് ഒക്കെ എഴുതിയിരിക്കുന്നതാണല്ലോ. അപ്പോൾ നമ്മുടെ കയ്യിൽ നീളത്തിന് അത്രയും ഇങ്ങനെ പിടിച്ചിട്ട് ഈ പെൻസിലിനെ നമ്മുടെ അടുത്തേക്ക് ഇങ്ങനെ കൊണ്ടുവരും. കുറച്ച് നോർമൽ സ്പീഡിൽ ഇങ്ങനെ കൊണ്ടുവന്നിട്ട് എവിടെ എത്തുമ്പോഴാണോ മങ്ങി പോകുന്നത് വെച്ചാൽ ആ സമയത്ത് ഒന്ന് കണ്ണടച്ച് തുറക്കുക, ഒന്ന് ക്ലിയർ ആവുന്നുണ്ടോ നോക്കാം. എന്നിട്ട് വീണ്ടും ക്ലിയർ ആവുന്നില്ലെങ്കിൽ വീണ്ടും ഇതിനെ പിന്നൊക്കെ കൊണ്ടുപോകാം. പിന്നെ ഇതിനെ ആദ്യം ഇങ്ങനെ അടുത്തേക്ക് കൊണ്ടുവരാം, പിന്നെ ബ്ലർ ആവുമ്പോൾ പിന്നൊക്കെ കൊണ്ടുപോകാം. ഇതാണോ പിടിച്ചാൽ നോക്കട്ടെ. ഇവിടെ ഈ നമ്പേഴ്സ് ലെറ്റേഴ്സ് കണ്ടില്ലേ? ഈ ലെറ്റേഴ്സിലേക്ക് എന്നെ നോക്കാം. രണ്ട് കൈ ഒന്നും പിടിക്കും. എന്നിട്ട് മെല്ലെ ഇതിനകത്തേക്ക് കൊണ്ടുവരാം. ക്ലിയർ ആയിട്ട് കാണില്ലേ? ഇപ്പോഴോ അടുത്ത് വരുമ്പോഴോ അപ്പൊ കുറച്ച് ഒന്നുകൂടെ പിന്നാലെ കൊണ്ടുപോവാം. ക്ലിയർ ആയില്ലേ? ഇനി വീണ്ടും അതേപോലെ അത്തേക്ക് ചെയ്തേ. അപ്പൊ ബാക്കിൽ കൊണ്ടുപോകാം. ഇനി ഒരു 10 പ്രാവശ്യം ചെയ്താൽ മതി കേട്ടോ. The second one is prisms. Prisms can be of loose prisms, Fresnel prisms, and the prisms in trial set, etc. The prisms are used for diagnostic and therapeutic purposes. In therapeutic purposes, the prisms are used in convergence insufficiency. In convergence insufficiency, the commonest use of prisms in orthotics for building up the functional versions of the patients and convergence sufficiency. The base of prisms are used in exercise periods. Occlusion therapy. Occlusion therapy is a passive treatment used for amblyopic eye or LASIK eye. Occlusion of the sound eye is the most effective treatment for amblyopia treatment by forcing the patient to use the amblyopic eye. Types of occlusion. There are 3 types of occlusion: total or partial occlusion, convergent or inverse occlusion, full-time or part-time occlusion. In total occlusion, all the light entering the eye is prevented. Employed in the amblyopic patients who have the visual acuity less than 624. Occlusion is done by using elastopath, gauze pad, tape, rubber occluder, etc. And next one is partial occlusion. In partial occlusion, does not cut off the total light entering the eye. It just degrades the vision of the normal eye such that the amblyopic eye gets better vision and preference. Occlusion is used by cellophane or a higher plus lenses. And the other one is partial or translucent occlusion is done in nystagmus, and total occlusion is done in amblyopia treatment. Conventional occlusion. In conventional occlusion, the sound eye is occluded to improve the eccentric fixation. And inverse occlusion, the occlusion of amblyopic eye so that eccentric fixation becomes less fixed and it becomes a steady eccentric fixation. In clinics, the occlusion therapy is instructed to the patient. Like, we are asking the patient to patch the sound eye and we are instructing the patient to do near work. It will be better for the occlusion therapy. While doing near work, or if they are using a red or green color pen for using for seeing everything and just they are copying to other book, etc. The hand, eye and the brain coordination are developing and it will give better result in the amblyopic eye. Next one is synoptophore. Synoptophore is an ophthalmic instrument which is used for diagnosing the imbalance of the eye muscle and treating them by orthotic methods. It is used to investigate the potential for binocular function in presence of a manifest squint, specifically used in children from 3 years and above. Also used to detect suppression and abnormal retinal correspondence. It consists of 2 cylindrical tubes with a mirror right-angled bend. A plus 6.50 diopter lens is in each eyepiece, which is optically set at a optical distance for 6 meters. Pictures are inserted in a slide carrier situated at the outer end of each tubes. The 2 tubes are supported on columns which enable the pictures to be more in relation with each other. It can measure horizontal, vertical and torsional misalignments. It is also used for estimation of rates of binocular single vision. First grade is simultaneous perception, tested by using 2 dissimilar pictures such as an object and its surrounding. For example, cage and a lion. The patient is asked to put the lion in the cage by moving the arms points of the synoptophore. The target should be appropriate to the patient's visual acuity. And the second grade is fusion, tested by using similar but incomplete pictures. For example, two rabbits, one lacking tail and one lacking bunch of flowers. If the fusion is present, one rabbit complete with a tail and flower can be seen. Stereopsis. Tested using two pictures of same object which have been taken from slightly different angle. If the images are fused and seen as a three-dimensional image, stereopsis is present. While checking in synoptophore, your patient should be comfortably seated in the position, and we have to check the chin rest, head rest and everything, and we have to look if the corneal reflection is seen to the instructor also, so that the movement of the eye converging or deviating can be noted by the instructor. Thank you.